Here's what happens to your body when you eat pineapple daily. From digestion to skin to recovery, this sweet fruit does more than you think. Let's start with what you're actually getting per cup of fresh pineapple, about 165 grams. That serving has roughly 82 calories, 22 grams of carbs, 2 grams of fiber, and nearly 80 to 88 milligrams of vitamin C, close to your full daily value, plus small amounts of vitamin B6, copper, potassium, and magnesium. It's also naturally rich in manganese, a mineral involved in antioxidant enzymes and connective tissue support. In short, low calorie, high nutrient density, and hydrating. A quick freshness tip: fresh pineapple beats canned for vitamin C. Canning can cut C multiple fold. So if immune support and collagen are your goals, fresh or frozen, no added sugar is your best bet. Now that you know what's inside, let's talk about the benefit pineapple's most famous for. Pineapple contains bromelain, a mix of natural proteolytic enzymes that help break down proteins. Think of it like a built-in tenderizer that can support protein digestion and post-meal comfort. Research reviews suggest bromelain survives digestion to a meaningful degree and can be absorbed in functionally active form. That's one reason you'll see it studied for systemic effects beyond the gut. Beyond protein breakdown, emerging work suggests bromelain may help the gut through anti-inflammatory actions and possibly by supporting a healthy microbiota balance, though this area is still developing. How to use this. If you struggle with heavy protein meals, a cup of pineapple with or after the meal can feel great. Pair it with Greek yogurt or cottage cheese to balance sugars and add protein. We'll talk glucose tips soon. When people say pineapple reduces inflammation, they're usually referring to bromelain. A systematic review of randomized trials found bromelain reduced inflammatory markers in multiple studies, either alone or alongside other therapies. It's not a miracle cure, but there's consistent signal for anti-inflammatory effects. There is also evidence for post-surgical swelling and pain, including after wisdom tooth or third molar surgery, where bromelain was associated with less pain and better quality of life in several trials and reviews. Again, it's not a replacement for medical care, but it's a promising adjunct. If you're active, pineapple post-workout is a tasty way to rehydrate and support recovery, especially alongside protein. But immunity and skin are where pineapple's nutrients, especially vitamin C, do a lot of the heavy lifting. That generous vitamin C hit is a big reason pineapple supports immune function. Vitamin C is essential for immune cell function and antioxidant defense, helping recycle other antioxidants and protect cells from oxidative stress. The bottom line is a daily cup of pineapple is an easy, hydrating way to cover a large chunk of your vitamin C needs while adding helpful antioxidants. And vitamin C doesn't stop at your immune system. It's a cornerstone for your skin. Vitamin C is required to make collagen, the scaffolding protein in skin. Reviews show that vitamin C supports collagen synthesis and wound healing with growing human evidence, especially when combined with collagen peptides for improvements in dermis density, texture, and wrinkle appearance. It's not instant glow, but consistent intake matters. So while pineapple alone won't erase wrinkles, its vitamin C makes it a smart daily player in a skin-healthy diet, especially when paired with protein, collagen-rich foods, and colorful plants. Now, let's zoom out to heart health and circulation. Pineapple supports heart health indirectly through antioxidants, vitamin C, fiber, and manganese, all of which can help reduce oxidative stress and support healthy vessels over time. Some reviews and summaries suggest bromelain may also influence blood flow and lipid buildup, but keep expectations realistic. These are supportive effects as part of an overall diet and lifestyle, not a standalone treatment. Speaking of overall diet, what about blood sugar? Pineapple is sweet, so how do you fit it in wisely? Here's the nuanced truth. Fresh pineapple's glycemic index generally falls in the moderate range, about 51 to 66, though it can vary by variety and ripeness. Some sources report higher values, especially for canned or very ripe pineapple, so portion size and pairing matter. A typical cup has 22 grams of carbs. Smart strategies. Portion. Aim for 1/2 to 1 cup at a time. Pairing. Combine with protein or fat, yogurt, nuts, cottage cheese, to slow absorption. Choose fresh or frozen over juice or syrup-packed canned fruit. Timing, post-workout or after a balanced meal, equals gentler glucose response. Media guides differ. Some call pineapple high GI, others medium. Takeaway, moderation plus pairing makes it work for most people. Mouth tingling or soreness? That pineapple burn comes from a 1-2 punch. 1. Bromelain breaks down proteins, including a bit of the protective mucus in your mouth. And 2, acids in pineapple sneak in and irritate the area. It's usually harmless and goes away quickly. Cooking, grilling, roasting, or pairing with dairy can reduce the effect because heat deactivates the enzyme, and dairy proteins give bromelain something else to work on. Allergies and cross-reactivity. Pineapple can trigger oral allergy syndrome in some people, and there's cross-reactivity with latex fruit syndrome, bananas, kiwi, avocado, etc. If you've had reactions to those, be cautious and talk to your clinician. Cooking often helps because it denatures bromelain. Acid reflux/GERD. Pineapple is acidic and may aggravate reflux in sensitive folks. Try smaller portions, pair with yogurt, or choose less acidic fruits if it bothers you. There's no clinical evidence that bromelain treats reflux. Medications and supplements. If you're on blood thinners like warfarin or have a bleeding disorder, be cautious with bromelain supplements. Some lab and preclinical data suggest antiplatelet/fibrinolytic activity, and reputable medical centers flag potential bleeding risk. Eating normal food portions of pineapple is generally considered safe. The concern is mainly with supplement doses. Also note, bromelain can increase absorption of certain antibiotics, e.g. amoxicillin, tetracycline. Important, always check with your healthcare provider. Diabetes and blood sugar. Pineapple can fit into a diabetes-friendly plan with portion control and pairing, protein, fat. Opt for fresh chunks over juice and consider post-meal walks to blunt glucose rises. If you found this helpful, hit like, subscribe for more evidence-based nutrition tips, and share this with a pineapple lover. In the comments, tell me your favorite way to eat pineapple, grilled, in smoothies, or with yogurt. Thanks for watching, and see you in the next video.